So again, welcome to our webinar on postpartum depression. Today we have Debbie Del Rosario and Kim Sundling with us. Debbie is a licensed clinical social worker with 25 years of clinical experience in direct and managed care environments. She's the director of Behavioral Health Clinical Programs here at Florida Blue. And Dr. Kim Sundling is a board-certified psychiatric pharmacist with both direct and indirect clinical care experience. She is the Behavioral Health Clinical Pharmacist at Florida Blue for both commercial and Medicare members. And with that, I am going to turn it over to you.
Thank you, Patty. For everyone that has joined, thank you so much for being here on this afternoon. Today we're going to be talking about postpartum depression. And maybe some of you have heard the term, maybe you're just here, you're curious, or maybe you've experienced this. But I hope that you're able to learn something from us today. So I'm going to go over the first half of the presentation today, and then I'll be turning it over to Debbie. And one thing before we get started, I want to preface this by saying we really appreciate your questions that you ask us. Just keep in mind that we will be going over more broad recommendations and things like that. So with that being said, if you have specific questions related to someone you know or for yourself or a spouse or loved one, those are things that you'll need to discuss with your doctor for them to best answer that, and they know everything that is going on with your symptoms and in your health. So with that being said, let's get started. I want to first say that, the journey of motherhood is a miracle. It's life-changing in more than one way. However, it can also bring forth a lot of challenges and unexpected things that perhaps we didn't know going into it. And we'll kind of go over some of those things. But just know that in some instances, unfortunately, we can, mothers can develop postpartum depression. And we'll go into what exactly that is. However, before we do that, I really would like to kind of go over some of the pathophys and the changes that go on in a woman's body when they have a child. So first, let's talk about postpartum. And if you're not familiar with that term, that is simply the period of time after giving birth. So pregnancy and the period after delivery can be an extremely vulnerable time for women. And if you've had a baby before, you know exactly what I'm talking about. Many of us know that there are a lot of biological changes that occur. We'll go into more details on that on the next slide of what exactly goes on in a mother's body after giving birth and also leading up to birth. There's emotional changes, you're not sleeping as much, you're away from work, or just really things have changed substantially. Financially, things are different. Socially, you're not able to do as much, perhaps. So there's just a lot of changes. And because of this can increase our risk of developing mental health conditions, especially depression and anxiety. Now, obviously, the topic we're talking about today is primarily depression. However, there are other diseases or illnesses, I should say, that can occur. However, today we're just going to be focusing on the depression aspect. So moving on to what I was talking about with the postpartum endocrine changes or hormonal changes. And if you're not familiar with the term hormone, essentially what a hormone is it's your body's way of communicating and making things happen in our body. We have these for a multitude of different reasons, but for now we're going to be focusing on what happens during pregnancy and after pregnancy. So when looking at this slide here, this chart or table on the left side here, you can see that there are a number of changes that happen. Kind of looks like a roller coaster in some instances, but we're going to focus on progesterone and estrogen to start. So the red line and then the orange line. So Estrogen and progesterone are incredibly important for not only the development of the baby, but also in order to stimulate childbirth. So while we are pregnant, or while a mother is pregnant, estrogen actually supports the baby's development. It helps transfer nutrients from the mother's body to the baby, and then it really can help the baby develop and mature. Progesterone, which is the red line there, that actually helps loosen up ligaments and joints to prepare the body and the uterus for birth. So when you're looking at that line, you can see right on childbirth where the dotted line is, there's a dramatic drop. And I mean, it's literally within hours of giving birth. And that drop, unfortunately, can cause us to have what's called baby blues, or feeling down, or having a low mood. And 70% of new mothers experience the baby blues. And it's no fault of the mother, it's just simply science. And when you look at this chart, this happens in anyone that gives birth, this massive drop. So I just really would like you to kind of understand that when a mother gives birth, that drops, and that's why we often experience baby blues, and it can go on for 1 to 2 weeks. However, I will say that it goes away with time. In addition, it's not interfering with daily activities. So now this is where we get into a little bit more of what postpartum depression is. With this decrease in the hormones, this can contribute to the development of postpartum depression, but it is not the cause. So if your symptoms are going beyond this 2-week mark, or it's really interfering with your life, that's when we start to think about postpartum depression. And we'll go into more details of what those symptoms are later on. However, just know that this drop in hormones is very normal, and with time, it usually gets better. However, if it goes beyond that, that's when we kind of want to start thinking like, hey, this may be more than the baby blues. So hopefully that helped you understand a little bit about the postpartum kind of time and what is going on in the endocrine area of the body. So postpartum depression. This is depression that happens during pregnancy or after giving birth. It's also referred to as peripartum depression, which that simply means that it can actually happen while you're pregnant. So pregnancy is not a protective factor against depression, meaning that if you're pregnant, you can't get depressed. That's simply not true, but we will be talking and referring to it as postpartum depression throughout this. It can affect a mother and potentially even the infant, depending on symptom severity. And the rate of this occurring, or percentage of women that experience this, is somewhere between, we'll say, 7 to 20%, depending on what you look at. But just know that this is something that could happen to any woman at any time when giving birth. It's not when you're with your first child, your second child. It can just happen at any time after giving birth. This is something that we're going to be talking about and re-emphasizing multiple times throughout this presentation, but postpartum depression is not your fault. I'm going to say that again. Postpartum depression is not your fault. It doesn't mean you are a failure or a bad mom. It's simply a behavioral health condition. It's a mental health condition that you cannot help. It happens for a multitude of reasons, which we'll be going into here in a few slides. But I just really want to emphasize that if you have experienced this or think you are experiencing it, it doesn't mean you're a bad mom or a failure. So looking at the pathophysiology, and pathophysiology is, what that means is just why does this happen, or what contributes to the development of postpartum depression. So unfortunately, in some areas of the medical world or in the psychiatric world, we don't exactly know why certain things happen. And this is unfortunately true for postpartum depression. There's a multitude of reasons why we think, hormonal, which I talked about earlier on that graph that you saw earlier, that drop makes some people start to develop symptoms if they're more prone to having it. Genetics, meaning if you have, a mother that had it, a sibling or something like that, you are more likely to have it, just like in any mental health condition. Genetics really can contribute. Psychological, meaning if prior to giving birth or pregnancy, you already had depression or bipolar disorder or something like that, you are more likely to, or you're more prone to having this because your body already has something or already has a mental health condition. Along with that, there's obstetric and then social life stressors, and we'll go into exactly what those are on the next slide here, but just know that one of these is not the sole cause. It's typically a combination of them, so just kind of keep that in mind when we're looking at the risk factors here. So risk factors, if I can talk here. I was already alluding to this, but prior history of depression and anxiety is definitely a large cause of that. Sleep deprivation, which if you were at our sleep talk earlier this year, we know how important sleep is. And then looking at the box below is if you have a high-risk pregnancy, birth complications, so, potentially having to have a C-section, if your baby has colic, things like that. And then on the right side there, you can see other types of triggers or risk factors on the right. So with that being said, I'm going to turn it over to my colleague, and Debbie will talk about signs and symptoms, and then we'll go into treatment after that.
Great. Thanks, Kim. Okay, so we'll go to the next slide. All right. So as Kim was indicating, there are multiple things that can happen, and every person is different. I think that's one thing we definitely want to highlight and indicate is that these symptoms vary. They vary from woman to woman, to situation to situation. And it's also, you think sometimes during these significant times of change that maybe this is just part of having a baby. But the component we wanted to highlight is, just be mindful, just be looking at these things as they may be compounding concerns or things that we want to watch. So some of the ones to start with are signs that may be associated sometimes with depression. There is maybe it's a persistent change in your mood, crying a lot, feeling sad or helpless. Sometimes it's the feeling that you just can't shake that there's so much. There's such a feeling of being overwhelmed that so much is now dependent on you and that doesn't feel that you can able to be moved or it mobilizes you during those times. There's also the feeling of guilt sometimes that you feel that you're just blaming yourself. I didn't do this right. I didn't do that. And it's unnecessary and just compounds that you feel that you're constantly making errors. One that's always hard to gauge is sleep. Obviously, during these times is a time when sleep and getting 8 hours is usually not possible as the baby's schedule is getting adjusted and waking up in the middle of the night. But it's still super important to monitor if you're having any sleeping too much or even too little, or even when the baby is sleeping that you're not able to sleep as well, to be able to monitor. And also there's the component of if you don't feel attached to the baby, maybe you are also going to lead into not feeling you can be there for others. So that could be excluding yourself, not wanting to be around friends or family that are of concern. Some areas that we wanted to highlight that are rare but, very serious that we hopefully you'll have be addressed immediately. With the first being if there's any thoughts of hurting the baby or yourself or their self, to definitely look out for. And if that occurs, outreach for suicide crisis lines, which is the 988 number, or 911 to get that immediate assistance. There's also the possibility that, again, in those rare situations that when reality may be impacted for particular women, they may be hearing voices or seeing things that are not there.
then that's a really important time to outreach and contacting your doctor to seek that services you need. So when you think about potential impact about postpartum depression, the one thing to be very concerned about is that many times when you are feeling that pull of sadness, of being overwhelmed, many times it's hard to take care of sometimes our own basic needs. And when there is a young baby relying on their mother for their needs, by not treating that postpartum depression, there could be obviously a significant impact to the baby as well. Many moms during this time may just not have the energy to go to appointments. Sometimes it might be just so hard to even think of leaving the house, getting dressed, now talking to other people that they may feel it's just not worth it, and they may skip their postpartum checkups. Sometimes, they have all these great education and information that was sent to them when they went home after delivering the baby, but they don't follow up on it. Sometimes it's difficult to focus on, just reviewing information. Again, maybe it's the lack of motivation that to do just one more thing just seems so overwhelming. So it's sometimes easy to be pushing those aside, thinking I'll just ignore it. Some other things that postpartum can do and help or impacting is that there may be a weight of maybe anxiety, feeling overwhelmed with the care that, can sometimes cause that difficult bonding with the baby. I mean, obviously, there can be some reactions to the child thinking that, some resentment, there might be some guilt, and there may just be feeling that difficulty to bond with them at that time that, that we really need to look at and not ignore. There's also, the mom may stop breastfeeding early. They also may not seek medical care, again, just feeling that they can't go out to do anything, so they, stopping many of those things. But it's, sometimes hard to care for ourselves, but, treatment is very important to receive and very important to receive as soon as possible. So one of the reasons why a number of individuals may not receive the treatment is that it's not diagnosed. Roughly about 50% of new moms go undiagnosed. There could be a number of reasons for that. Some don't want to disclose to their family how they're feeling. There's a lot of that assumptions that they can take on more responsibilities, or this is what I'm supposed to deal with as a mom, and sharing that outside of it is sometimes hard. There's that stigma that new moms should have it all together. Day one, you should know what's going on. But, there's no matter how many books or classes that were attended before that baby comes, it would never, ever prepare you for what happens when the baby actually is present and what's going on. So there will be moments of uncertainty, not knowing what's going on, if you're doing what you think is the right thing, and that fear can sometimes, think that, well, I can't talk about this to anybody. Might make them depressed. Sometimes they fear of abandonment. They open up that they may be judged by as a quote-unquote bad mom. If you admit that you are not bonding with your baby, there's the concern that if I share that outwards, I would be looked at negatively. And that all those support, all those individuals who might be there to help support me might leave because they are judging that, she's a bad mom. So there's that concern. Sometimes it's the lack of awareness of what is going on, the signs and symptoms, and unfortunately there's just not as much. So we are just really thankful for this opportunity to present information collectively to you as a group on the signs and symptoms for you and for family members. And thank you for being part of this so we can increase and continue that awareness of how we can help. Some other things would be, some individuals don't have mental health access, and, they may not be able to be assessed by professionals who can see those concerns and are aware of what's going on. So, without that ability to be connected with behavioral health providers, they might not be diagnosed and therefore obviously can't be connected with the right resources. A last component to include is that, racial disparity. Many times there are people of color who are especially likely to experience postpartum depression. There was a study that we looked at collectively that shows that, new mothers of color experience postpartum mood disorders at twice the rate. So about 38% of those versus a white mother in the United States. And up to half of these individuals do not receive support. They don't seek out treatment, which obviously can impact them from a longer term. There was also, again, that study that screened, white women, Asian women, that about 19% of the Asian population were less likely to be screened. African American women were 36% less likely, and Native American, Hawaiian, Alaskan Native, and multiracial families or women were usually about 56% less likely to receive support or treatment. So, we're significantly concerned about these findings, and hope that we can, with these continuing promotions, awareness, and expanding, we could overcome any stigma or concerns people have, so they can hopefully outreach and seek the care that they need. So the message, again, that we're hoping everyone takes away from this presentation is that if you need help, don't sit back. Please ask for help as soon as possible. If there's any recognition of any certain signs or symptoms, talk to your healthcare provider right away. So, that could be any provider. There's during that stage of life, there is essentially many opportunities that you can interact, or a person can interact with a provider. So there's the prenatal care provider, so the provider who actually provided that medical care during the pregnancy, an OBGYN, for example. There could be the primary care provider, so the main family practice provider, for example, that provides services. They're available. There's also the possibility of talking to a mental health provider, psychiatrist, psychologist, social worker, or the baby's doctor, because there is a number of appointments that the children go through in their first year, 2-year time frame. And during these appointments, I think hopefully the providers will be asking questions about how are you doing. And they could be asking, and I've been asking you to complete maybe a depression screening form, or they may be just genuinely saying, well, how are things going? And I think the biggest thing is to be honest and share how you're doing. The providers want to know, if you're experiencing things that can impact how you are caring for yourself and your baby, and having those honest, truthful responses will help guide them to those recommendations or supports that will be of the best services. So hopefully that is in place. So if that healthcare provider does talk with the mom, they validated that there is a postpartum depression, then the next kind of step is looking at treatment options. And those treatment recommendations will vary. I think we started with this conversation of saying that it varies person to person. There is the need to look at the whole person, their medical history, medical needs, behavioral health experiences and history, and then the severity of the postpartum depression themselves. So the recommended treatments that might be the next steps is individualized to that person because they're looking at that whole view. Some options that may be discussed or identified is, kind of the first one is like psychotherapy, which is, I generally think of that as, just a talking therapy. So it's meeting with a behavioral health licensed professional. Again, that could be a social worker, psychologist, mental health counselor. And the goal of those sessions is to look at how to provide support, maybe get some insight to the individual, and then guide that mom on creating or even enhancing their current coping mechanisms to make sure that they're healthy and that they'll be able to use those on a long-term basis to help them through whatever skills that they need. Another component of this is that, sometimes medications could also be something that is utilized. It could be a combination of psychotherapy and antidepressants, but again, that is based on recommendations by the clinician, based on that individual mother's medical history, and based on that medications. They have found that sometimes that combination of therapy and antidepressant is recommended based on the symptomology of the mother. So psychotherapy could be for those who maybe have mild to moderate depression, and then maybe like therapy plus medications may be recommended for women who are exhibiting moderate or severe depression, for example. But again, that's those discussions with your provider about it. But the antidepressants, are safe. to taking there are certain ones that are safe to taking while breastfeeding, and that's just identifying and talking with the clinician about it. A component just to be mindful of is that, the medication, when it's prescribed, it does take a bit of time for them to actually show some significant changes or adjustments. That could take 4 to 6 weeks. So the real important time during that time, as you're talking with your provider, is, continue to take them daily. Don't stop all of a sudden because you think they're not working or they're done working, you don't need them anymore. Either way, it's always important to talk to your doctor about it before deciding to discontinue any type of medication. Lastly, I think this is something not only for mothers, but for kind of across the board, is just a reminder about those self-care opportunities that we need to take advantage of. That, we needed to, especially for moms, it's important to take a break. It's okay to not do anything when the baby is sleeping. There's no need to continue to think you got to do stuff around the house, got to move things. It's really a time that is also important to be able to refill your own cup, your own things that to give your own self abilities for energy, to way to continue on. And the only way to do that a lot of times is taking those breaks, relaxing, take a moment for yourself to do that. Getting enough sleep, I think we've talked about that as best as possible with the baby and their schedule, but get as much sleep as necessary with it. Eat well, exercise, outreach to your social networks, social connections is key to make you feel that you're not alone, that you have others who are around you. And if you need help, raise your hand, ask about opportunities. Many have gone through the same things. They recognize and are there to help support as these things come up. So wonderful for that. We wanted to provide a list of resources. So again, for asking for help, there is not only your own family or friends that can help there, but there's also obviously national and local resources that can help you, your loved one, if you have seen anybody who identifies or seems to need these services. One, we indicating if you're seeking any behavioral health care, Florida Blue members can outreach to our wonderful provider, Lucid, and they can provide with any national resources for providers, educational materials that may be impactful for you. There's also the March of Dimes, which is a nonprofit organization, again, that works to improve the health of mothers and babies. Wonderful resources. And then for educational material, so many great information on the different sites. We've got the American College of Obstetricians and Gynecologists. There's NIM and NAMI. Again, they have multiple different areas, and again, just not for this topic, but for multiple information that may be impactful to show any signs. Some test toolkits that may be helpful for that at there. And as well as there's also international information for the postpartum support. International website is available for those individuals who need that connection. So our last takeaway, and I love this little baby, so cute, but to note that postpartum depression, again, as Kim said from the very beginning, and hopefully you recognize here as well, it's not a reflection of you. It is just a complication of pregnancy. This is one that other women have gone through, that they have dealt with. They have been brave enough to say they needed help, got the help they needed, and that's something that we're hoping that others will recognize as well and see that, you're not alone. It's not a reflection of you. It is one that others have gone through, and help is available. So thank you. Any questions?
Okay. So if anyone has some questions, go ahead and put it in the Q&A pod. The first one we have here is, how do I talk to my partner, spouse, if I'm worried they may have postpartum depression?
I can go ahead with that one, Kim. I think anytime that you are talking with a loved one about things that you're seeing, I always start from the most important thing is that you're coming from a place of caring, you're coming from a place of concern, and just saying that, I love and care about you, and I am seeing that you seem like, you're sad a lot, or whatever signs that you're seeing around there. And I want you to know that you're not alone. I'm here by your side. And, how are you feeling? There's the big thing they say, don't be judgmental. Don't automatically come with the answers right away. Give that person the opportunity to share what they're feeling, that opportunity to be truly listened to, and seeing where the next step is. And based on how they say or what they share with you, obviously indicate we can look for other resources, we can look for support, we can, whether that's internally or, looking to get professional assistance if that seems the right step, but letting them know that you care and are there by their side, I think sometimes is the first step, and that you see them.
Okay. The question came in, is there something that triggers postpartum depression?
That's a great question. So unfortunately, the answer is a little complicated. There isn't necessarily something we know for sure triggers postpartum depression. And I went over a little bit about the pathophysiology and what are some of the risk factors. But we do know with those hormonal changes that I was talking about early on in the presentation that those could potentially, quote unquote, trigger someone to experience some of that. However, keep in mind that they likely have other risk factors besides the hormonal drop, considering 70% of moms do experience, the baby blues that we talked about. However, that doesn't mean they're going to go on to develop postpartum depression. It's just what a mother's body does after having a baby. So the short answer is there's not necessarily something that triggers it that we know of at this time.
Okay. How long can postpartum depression last?
Yeah, and Debbie, feel free to jump in as well. There's really not a time limit. Unfortunately, This is something, and was someone saying something?
Oh, no, I was just agreeing with you, Kim. Yeah, there's not a, okay, I'm on week 4, therefore this must be resolved. Again, it goes per person. It's that, kind of that chemical change. It could be, kind of mentally feeling that you're able to handle the stress that's going forward with you. It could take, a while to get through it. I think the big thing is that, just like with anything, the sooner you're able to see some concerns or kind of having somebody hold being by your side to help you through it, is to get that done as quickly as possible, because that gets you that much closer to being back to the way that you were before, or you felt like you were before.
Okay. Next thing that came in, I will be a first-time mom in October, and I've dealt with mental health issues in the past. Not anything that warranted medication. Should I bring this up in my next OB visit just in case we need to be a little more proactive in treatment?
I say yes. I think anything that about you and yourself should be shared with your provider, so they're aware as well. And it could be nothing changes, there's no issues, but at least they are also with you on this journey and can be also on the lookout for any concerns or monitoring that they need to put in place.
Okay. Yeah, I agree.
Okay, go ahead.
Oh, I was just going to say one other thing. I completely agree with what Debbie was saying, because the earlier you catch it, the better. It doesn't mean that because you have dealt with those in the past that you're going to have it. Like I said, there's a multitude of potential reasons behind it, but the earlier the better to catch it. So, great question.
Okay. Mm-hmm. If you had postpartum depression with your first pregnancy, are you more at risk having it in a subsequent pregnancy, or does that vary by pregnancy?
Yes and no. So that's not a very good answer, but I guess what I want to say, it really depends on the mom. But if you actually look at the data and look at the, patient cases, clinical trials, and things like that, you are at a higher risk if you had it in your first pregnancy to have it in your second pregnancy. But there are many moms that have it their first pregnancy but don't get it again after giving birth with their second, third child. So that was why I said yes or no in the beginning.
Gotcha. Okay. And I think you spoke about this a little bit, Debbie, but a question came in. Can I take medications to manage my symptoms, and can I take medication while breastfeeding?
Yes.
I was going to give it to the pharmacist.
Yeah. No, you're good. So to answer both of those questions, yes, you can take medication while you breastfeed and to also manage your symptoms. However, I will say that there are some medications that you have to be careful with when breastfeeding and if you're pregnant or right after giving birth. However, that is something that you have to talk about with your clinician, doctor, OBGYN, and things like that, because it's a decision that needs to be made by you after you understand, risk if there are any and things like that. But medication is it can be very effective. However, I will make sure to I want to make sure to mention that therapy, like Debbie was talking about, is often just as effective or more effective than medication in mild to moderate cases of postpartum depression.
Okay. Can you sort of review those treatments again? Because what kind of treatment will help kind of came in. Do you want me to go back to that slide?
This slide?
Oh, there you go.
Yeah, it's that one. Let's maybe see if we can make it a little bigger.
Yes. So, again, these are, kind of the different components. So, again, the first one is psychotherapy. So I usually kind of equal that to talk therapy. So, again, that's when you're with that counselor. They are talking about kind of your feelings, your emotions, things that are going on. They take assessments of your, past history. How did you deal with stress? How did you deal with sadness? Looking at all those and finding maybe that next step that would help you kind of move beyond it. What are some barriers, and look at ways of overcoming that. It could be also looking at, how have you coped with those sadness in the past, and like, maybe that's not the right choice. Here are some other options, and giving them those skill sets to hopefully build resiliency and being able to move forward. The antidepressants are the ones that, Kim was mentioning about the medication. And again, sometimes with an individual, the provider may recommend all three of these options that are listed: psychotherapy, antidepressant, self-care. Depending on the severity, may say psychotherapy will be great. Self-care, I always say it's self-care from that side. But they may give different recommendations on kind of what meets that person, where they're ready, and kind of the needs that they may have.
Okay. Thank you.
Sure.
Can you review again how postpartum depression is different from baby blues?
Yes, I can talk on that. So actually, let me see if I can, right? Yeah, I'm able to move it. I'm just going to go back to that chart, maybe. There we go. Patty, I may need you to make it bigger. I don't know. I don't want to mess anything up. I have been known to cause problems before. So looking at the chart here, it kind of looks like a roller coaster. I mean, let's face it, pregnancy and birth and postpartum is a little bit of a roller coaster. So the I shouldn't say chemicals, the hormones that are increasing, progesterone and estrogen, those increase, and along with the prolactin there. I didn't mention that one earlier. Prolactin is responsible for breastfeeding. It helps stimulate milk production. But really the ones we want to focus on in terms of baby blues is the progesterone and estrogen. So when you're pregnant, these increase a lot, and there's a lot of different reasons behind that. And we just naturally have estrogen and progesterone in our bodies or in a mother's body just because we need them, and that's how we develop and all that. I don't need to go into a total anatomy lesson here, but those increase during pregnancy, and then in order for a mother to give birth, those hormones have to decrease. Otherwise, a mother would never have a baby. So when those decrease, it's such a dramatic drop, and you can really see that in this picture here. It's like going down a roller coaster, a sudden drop here, and because of that, it can really impact how a mother is feeling. And with that drop, we often call those baby blues, and that's related to the progesterone and estrogen dropping. So with that drop, 70% of new moms experience feeling down, a low mood, or feeling emotional. And baby blues go away with time, and they do not interfere with the day-to-day activities such as, you know, feeding your baby, putting a diaper on, doing whatever it is you do. And with that being said, it doesn't require treatment either. There's no treatment. It just usually gets better with time. However, postpartum is very different from that. It is debilitating. It's serious, depending on the severity of your symptoms. I should point that out. But that lasts beyond 1 to 2 weeks, and it impacts your day-to-day quality of life. And it usually does require treatment.
Okay.
So hopefully that helps.
Thank you. I don't see any other questions in. I'm just going to talk for a minute about, for those of you that have attended today, if you could take a moment and fill out the evaluation. You can either click on the survey evaluation link, or you can hold your smartphone camera up to the QR code. We do have several flyers for you. The Florida Blue Center flyers. Several of those centers have community specialists that are licensed clinical social workers. We've got some information about an EAP provider. And also we've got a flyer about Mequilibrium, which is a digital platform that helps with resilience and stress management and work-life balance. So if you get your insurance from your employer, check with them. Oh, that's a great question. Okay, so the question just came in asking if there's anything for postpartum depression in Mequilibrium. Kim or Debbie, do you know? I'm not sure.
Not for specifically for postpartum, but there is questions that are very similar, which again is the same type of questions that are asked when somebody is going through a postpartum depression. There is an analysis that looks at, you know, how have you been feeling for the last couple of weeks? Are you losing interest in things you normally find joy in? Things like that. So they do highlight some, questions that may look at your kind of depressed or sadness scale on there, but not specifically, unfortunately, for pregnancy.
Okay. But if you do get your insurance through your provider, just check with them to see if that might be a benefit that you're entitled to. And we're also coming up next month on flu season, so I've got the flu vaccine flyer there. We will have some dates in September and October where some of the Florida Blue Centers will have vaccine clinics with Walgreens. So I wanted to thank everyone for joining us today, and especially the participants who just shared some beautiful stories with us, because it's quite a difficult topic. So Debbie and Kim, thank you so much for facilitating for us today and presenting this important information. I'll leave this up for a minute, but I will get a follow-up email out tomorrow to everyone with the recording link and with some resources all the resources that Debbie mentioned in the back, and we'll get that out tomorrow. So thanks so much for joining us today. I hope you have a wonderful rest of your day.